Hello, and welcome to the MedSurg Nursing Journal podcast series. This series provides extended content relating to articles published in the journal, such as author interviews and roundtable discussions. Before we get started, we have a special offer for our listeners. You can save 50% off 1 and 2 year subscriptions to MedSurg Nursing, the official journal of the Academy of Medical-Surgical Nurses. Simply visit medsurgnursing.net/offer to take advantage of this special discount. In this episode, MedSurg Nursing Journal editorial board member Dr. Diane Daddario talks about the specialty of medical-surgical nursing, her involvement with the Academy of Medical-Surgical Nurses, and her service with the International Council of Nurses Nurse Practitioner Advanced Practice Nursing Network. Through her work on the communications subgroup of the International Council of Nurses, Dr. Daddario met Dwi Kartika Rukmi, an international member of the Academy of Medical-Surgical Nurses from Indonesia. During their conversation, Dwi discusses the role of medical-surgical nurses in Indonesia. We are pleased to present Dr. Daddario's interview with Dwi Kartika Rukmi.
Hello, everyone. My name is Diane Daddario, a member of the MedSurg Journal editorial board. According to AMSN, medical-surgical nursing is the single largest nursing specialty in the United States and beyond. Medical-surgical nurses provide care to adults with a variety of medical issues or who are preparing for and recovering from surgery. They have a broad knowledge base and are experts in their practice. Medical-surgical nurses have advanced organizational prioritization, assessment, and communication skills and are leaders in coordinating care among the interprofessional healthcare team. Medical-surgical nursing is practiced in settings across the healthcare industry, including hospitals, outpatient settings, in homes, via telemedicine, and other non-traditional settings. The specialty of medical-surgical nursing happens in almost every care environment because medical-surgical nursing is what you practice, not where you practice. I have been a nurse for 40 plus years, with all of my years of nursing being in some aspect of medical-surgical nursing. Currently, I am a nurse practitioner in a skilled nursing facility and also nursing faculty. I have had an amazing opportunity to be a member of the International Council of Nurses, Nurse Practitioner, Advanced Practice Nursing Network, and served on the communication subgroup. It was through this committee that I met Dwi Kartika Rukmi. Dwi, you'll have to correct me and tell our audience the correct pronunciation there, since I probably messed it up, who was one of the committee members from Indonesia. AMSN, or Academy of Medical-Surgical Nurses, now has members in 12 countries in addition to the United States of America. I would now like you to meet Dwi, who is also a member of AMSN. She will introduce us to the role of medical-surgical nursing in Indonesia. Welcome, Dwi. Hopefully we will get to meet in person one of these days when COVID restrictions will allow us to travel again. Please tell us how you started in nursing.
Thank you, Diana. Hi, everyone. My name is Dwi, and currently I'm working in Jenderal Ahmad Yani Yogyakarta University. My university is a private university in my area. I have been a nurse for 14 years. I graduated from bachelor degree in 2004 and straight continue my nursing profession program, and I finished all of it in early 2006. After I have completion requirement, I applied as a junior lecturer at my university in August 2006, and in the beginning of my career as junior lecturer, I was teaching and guiding students in hospital as general nurse, and in 2009, I continued my master degree in medical and surgical nursing, and I graduated my master degree in 2011 and also graduated from my nurse specialist program with neurology focusing in 2012. So I become and focus in medical surgical nursing since 2012. It has been 8 years, I think. In Indonesia, lecturers have the obligation to fulfill called the Three Dharma, namely education, research, and community service. As my medical surgical nursing lecturers in education, I do some tasks as teach medical surgical nursing classes, guide and supervise students who practice in the hospital, and devise suitable guidance methods for our students when practicing in medical or surgical rooms. And in research, I did research in medical surgical area, and I have research interest in HIV/AIDS, cancer, and neurology. I have some publication that I publish in my research kit account. And for community service, I do it in collaboration with lecturers from other departments like community department, pediatric department, maternity department, and soon, or community health center nurses through some programs such as free health checking, health screening, counseling, and health education. And another form of community service that we do is apply the result of research in community setting to improve the level of community health. Apart from this treating, we are also required to develop ourselves according to our knowledge through various things such as seminars, trainings, courses, education, conferences, or being active in professional organization and others.
Thank you, Dwi. I think that the tri-dharma of education, research, and community service is so important for nursing faculty. What is nursing education like for others overall in Indonesia? Is this the same for all nurses?
To become registered nurse in Indonesia, someone could start from two different ways, diploma or bachelor degree. And when someone starts from diploma degree, it will take 3 years to complete. They can upgrade their level into bachelor degree through a special class or special program that can be done in 1 year plus 1 year for nursing profession program. And some universities in Indonesia provide these programs. But when you or someone start from bachelor degree, it will take 4 years plus 1 year for nursing profession program to complete, and it will take for about 5 years totally. Decision to choose which way they want to is personal, and based on my informal interview with my student, their preference to choose they will choose from bachelor or diploma is based on their financial strength or because their parents' advice. After students graduated from their degree, students should take national examination of nursing competence. And Indonesian government held nursing competence examination 3 times a year. Someone must try at least once. And when they did not pass, they can try in the second trial and soon. But after they pass the examination, they will get exam passing certificate that can be used as a requirement for apply registration certificate for nurse. When registration certificate for nurse is on your hand, so you officially become a registered nurse in Indonesia. You could apply jobs in hospital or in somewhere else as fresh entry nurse. Next, you should apply nursing license or practice because if you work as a nurse, license of practice is needed. The registration certificate for nurse should be extended every 5 years, and the extension is approved when the nurse has reached a minimum of 25 SKP or Professional Credit Unit, a point that's set by the Indonesian Nursing Professional Organization. It can be obtained through self-development such as courses, seminars, training, education, researches, or community services.
That way of the educational journey sounds similar, that there can be different routes. I myself ended up doing the long way, doing licensed practical nurse, a 12-month program first, and then a 2-year diploma program. And there weren't a lot of bachelor's programs at that time, and then I went that, and then BSN, bachelor's degree, master's degree, and then finally doctoral program. But as I said, went the long way.
Oh, yes, I see.
How would you describe medical surgical nursing in Indonesia?
In my opinion, medical surgical nursing in Indonesia has had many developments and improvements. When I was a child, nursing education in Indonesia was only up to the nursing school, or you can say equivalent to senior high school for nursing or nursing diploma level. But now I can find nursing education even up to the doctoral level. And many nursing training can also be found in Indonesia at affordable prices. Although for some reason, collaboration and knowledge seeking from a country with a better nursing system is still needed.
What are some of the areas where medical surgical nurses work?
Many medical surgical nurses in Indonesia are placed on medical surgical ward, and sometimes in special wards such as isolation rooms, intermediate ward, or intensive ward, as long as they still in the context of medical surgical nursing. Because when someone focuses in medical surgical nursing, of course, in their own development, they will also take things related to their knowledge, such as they took training, seminar, or other courses in medical surgical nursing also.
How do your shifts or the type of hours that the nurses work? We're used to some work 8-hour shifts, 7 a.m. to 3 p.m., 3 to 11, 11 to 7 a.m., or 7 a.m. to 7 p.m., then 7 p.m. to 7 a.m.
Nurses in Indonesia generally work in 3 shifts, namely morning, afternoon, and evening or night. Morning and afternoon shifts are around 7 to 8 hours, and usually, as my experience, morning shifts start at 7 a.m. to 2 p.m. and afternoon shifts start at 2 p.m. to 9 p.m. And night shift will be longer than other shifts. It takes around 10 to 11 hours from 9 p.m. to 8 a.m. And nurse schedules are compiled by the head of the ward and approved by the head of the hospital nursing department, and change of shift or holiday schedule according to the schedule that has been made earlier.
When we were committee members together, it was exciting to learn about your role in medical surgical nursing. Please tell us what your experience has been as an AMSN member so far.
It's great to be an EMSN member. The first time I knew about EMSN is from you as my senior in the ICN communication subgroup, and I'm very grateful for that. Sometimes I still hesitate to join an international nursing organization, but when you recommended EMSN to me, then I learned what is EMSN, how EMSN works, and what is EMSN benefit through their website. I'm interested in joining as a member. So I joined EMSN in the middle of 2020. Joining an international organization like EMSN certainly gives me more benefit. I can see more broadly about nursing, medical surgical nursing, especially from United States. And I also learned about many current nursing issues through the journal that EMSN publishes or through the EMSN library. Sometimes I attended public lecture or webinar held by EMSN, although it's not many because the time difference between America and Indonesia.
I also find it so fascinating, even though we're worlds apart and so far apart, that medical surgical nursing and other areas of nursing, there's some differences, but yet so many similarities. And we learn so much from each other.
Yes, you're right.
Is there anything else that you would like to share?
I'm proud to be invited to a podcast by EMSN, and thank you for this precious opportunity. I hope that in the future I can further improve myself through various things for nursing, including through EMSN.
Dwi, thank you very much for taking the time. It's my evening in Eastern United States and your mornings starting out your day. But thanks again for taking the time to share this with AMS members, nurses, and others around the world about nursing in Indonesia. And we will definitely look forward to your involvement with AMSN. Thank you again.
The MedSurg Nursing Journal podcast series is owned and produced by Genetti Publications Incorporated. All rights reserved. No portion of this podcast may be used without written permission. Dr. Diane Daddario is a nurse practitioner in a skilled nursing facility and nursing faculty in Pennsylvania, and a member of the MedSurg Nursing Journal editorial board. Dwi Kartika Rukmi is a medical-surgical nursing lecturer in Jenderal Ahmad Yani Yogyakarta University, a private university in Indonesia. For archived episodes of this podcast and to learn more about MedSurg Nursing, visit the journal's website at medsurgnursing.net. You can also subscribe to the MedSurg Nursing Journal podcast on Apple Podcasts, Google Podcasts, Spotify, Stitcher, TuneIn Radio, our hosting site Spreaker, and everywhere podcasts are found.